Yeah.
I guess what I'm asking is this on your head? Like, how did you get that?
So this right here is a dog bite, and then this is a dog bite. So this is from when I was younger. So that's not actually from my explosion. And then my back is messed up from being an IED blast. That's what my back, and then my
IED.
So it's an improvised explosive device. It's a common method of how troops are hurt nowadays. Like the common outcome or injury that would come from an IED blast would be a TBI or a traumatic brain injury. And then but depending on the level of the blast and the level of the explosion, you could have like you might get injured or something like that.
So you would carry around what?
My combat load.
Gear?
My combat load is I would have my day pack, have my flak, have my Kevlar, and then when I was in Afghan, I was a saw gunner. So a saw gun is like a light machine gun, and so that's what I was carrying. But on average, I would say my combat load would be like 130 pounds. And that's what, like, I have, like, with my interns, my hips.
Your hips.
Yeah, my hips are, like, really tight, and it's, like, right here on the back. And it's crazy because the VA's like, oh, your injury is probably from the way you squat. And they just think, like, I squat a little too narrow on my knees because, like, I had to show I was working with an occupational therapist. And I told her, I was like, well, you know, if that was the issue, I was like, I don't squat like a crazy amount of weight. I was like but I'm wearing...
Did you march for like, or I don't know what the right term is. Like,
yeah.
For like a lot.
Yeah, so the longest I ever did...
With that weight on you.
Yeah, like the longest I ever did with 130 pounds on me was like 30 kilometers, which would be...
So what I'm seeing in my own practice, and I'm not even a VA like doctor or anything like that. I keep seeing a lot of veterans coming in that are carrying like 90 plus pounds, and they're having to march for long hours,
and then
or days, years, and they have this hip problem.
Mm-hmm.
And I haven't seen any literature documenting it, but I'm wondering now if that's a thing, because it's like basically the hip socket gets grinded up into the acetabulum. Okay, so the hip is like a ball and socket, right? And when you have that extra weight, see, I don't know why us women don't get it when we're pregnant. You know, we're carrying around an extra 50 pounds.
Yeah.
But guys seem to get this thing when they're marching and they're just jamming their hip up into their socket.
Like pretty much most of my tightness is like
but from the way you squat, that does impact your hips.
Yeah.
And that's why they're asking you that.
When I did go see an orthopedic, and because I had issues with my knees, and essentially like it's like when I drive a lot, I do drive Uber Lyft. And it's like my knee will just get really tired, and then it's like when I'm walking after, my knees will give out. So when I went to orthopedic, I brought up my knees, and I also brought up my hips while I was at it. And he tested the ligaments in my knees. He's like looked at my hips and everything, and he's like, "Yeah, there's nothing wrong with you." And it's just like I was like, we're trying to request MRI. You feel like that's popping?
Yeah, that's your rectus femoris. So that's the main tendon of the knee. No. Okay, so...
And so this knee does it too, but it's not as...
It's not painful.
No, it doesn't hurt. Actually, it kind of does. Oh, there we go. We just cracked it. I got it cracked.
Hopefully we got that up. That feels like your tendon is really overcontracted there. Have you ever done like foam rollers on your quad? Have you ever worked on your quads? Has anybody suggested that?
My occupational therapist was saying that...
Yeah,
I do. That's all I do is my massaging. It was saying that my quads are overdeveloped, and it's causing. I would agree. It's causing my knees to kind of shift, and it's like. So I've been trying to work on my hamstrings more.
No, don't have to. You need to just. Well, you can, but it's not going to fix that.
All right.
No, you got to literally get a foam roller and stretch it.
All right.
Like you got to stretch your quads. Like you've got to stretch them.
I do that.
But then you got to put a foam roller. You got to put a fulcrum in there, and then stretch the muscle because it's pulled up tight. It's from your pelvis as well, actually. It's your pelvis that's compromised. Like, why is it mostly in that knee and not in that one? It's because that's probably your anterior side. Most people, their right sides are shifted forward. I don't know yet. I'll find out in a second. Do you understand that this is pulled tight on you? Mm-hmm. So you go to bend your knee, you're just ripping it.
Yeah.
You've got to lower that quad down, and you'll hear me say it a lot on my videos because it's not the only time that I've said this.
Yeah.
But it doesn't fully click until you're in here.
She's always beat me like, "Hey, you paying attention?" I'm like, "I am. I'm
just
watching."
The cracks.
I'm watching, and she's like, "No, you gotta listen.
You gotta take. So when I do, you see me use the roller, it's very uncomfortable. but I will
does
actually
look like
physically do that to you and lower that
Okay.
down. Okay, and it's not very fun, but the hamstrings. The only reason why I ever worry about the hamstrings is because the sciatic nerve runs through there. So you see me working on the hamstrings or the biceps femoris back here. It's because I'm trying to get that nerve clean. I really don't care about the muscle. But in a knee case, I care about the muscle. But it's mostly L4, low back, innervates the knee.
And I do have my I take duloxetine, so it's it does have nerve pain in it, so there may be more pain there, but I just don't feel it as much,
Oh.
because of my medicine.
Okay. Well.
That's a good thing for you.
Yeah, I was gonna say I'll take that into mind. I'll take that in mind when I'm working on you to stop. Like, if he's not saying anything, and I think we've gone too far, then okay.
I may not feel it.
You might not feel it. Then just look backwards for me.
Which
Just
way?
go straight back.
Okay.
Yeah, and then forward. Look down. Yeah, I see it pulling here on the left. Okay, and then back to neutral, and then look over to your right. Good, and then to the side. A little restricted there, huh?
Yeah, a little tight.
Any pain there on the left?
Yeah, it's a little bit tight
Yeah,
here.
right there. I don't know if you can see the knot on the camera.
I had to Google it, what a knot was.
Yeah, it's just a muscle spasm, basically, and scar tissue buildup with it. It's right here. I don't know if you can tell, like, this side's just thicker than this side. So go down, look down again. Yeah, it's just pulling on this left-hand side, and then you can't. And then
Yeah, I can feel the.
now look to the right. Nothing much there. His head goes just fine that way.
Yeah.
And then it
I
gets
can
stuck,
feel it.
and there's
It's
the
tight.
knot. Right there, you can clearly see it. It's clear as day right there.
I think it's that tech neck,
It could be. You're looking down and to the right.
That felt good right there. Were you doing push from my shoulder?
Oh, I'll
Yeah,
go
right
back
there.
to it in a second. Right there, you missed it then. Yeah, that's a huge knot right there. We just gotta bring the shoulders down. Not like that though, not dropping them down. They need to come down like this way. And you can't force it. I actually have to do it for you. I have to come in here and do a lot of this type of work. Okay, that's really, I need somebody to do that to me. Linnea's like, yeah, me too. You should be able to take twice as much as that. I'm going on half capacity here.
I know, I'm like, why is he already making this?
I'm vocal.
I'm vocal.
No one inflicts pain on me. No one. But I will. This is acceptance.
Nobody touches me unless I want them to. Okay. On your back, please. Let's start at the beginning. She's like, what did I get? What did I sign up for? You want to turn the AC?
Do you just want my neck to go limp?
What?
Do you want me to just go limp?
Oh.
Is that what?
This is going to be a process. You just do whatever you want to do. I mean, it's you just, if you can be as relaxed as you can, that's more beneficial, but it's not necessarily necessary. Because at the end of the day, it's the joint right here that I'm going for.
Mm-hmm.
See that? Knuckles, okay? If you can handle it. Haven't heard anything past 5 minutes. There you go. Breathe. Breathe. Ooh. Dig. There it goes. See? It's involuntary. What is your job again? What do you do right now?
Right now, just live life.
There you go. Breathe, no breath, that's it. When I don't feel the shoulders rise, I'm like, let's stop, rethink that, go again. There you go, that's it. Just gonna get rid of it. There, done. Okay, done with that one. It was smaller, I was like, I'm just gonna go through it. Chin back.
Told you I was trying not to crack it this
I
morning.
can see that. Now here's the stuck side.
Oh.
Not anymore. It's right there. It's so sore. I'm sorry.
You're fine.
Right. I'm gonna have to come back to that one later, okay?
Okay.
C3 on the left is like, no. There was a lot of cracking going on,
Yeah,
but
there
you know,
was.
it wasn't quite the one I wanted.
That was nice.
How was it?
It was nice.
Yeah, having somebody else do that for you.
I know, I usually do it to myself.
I understand. Okay.
Should I hold the top?
Not yet. See, that one went just fine. Not the baby toe either. Weird.
He's stuck.
I can never get a baby toe.
Oh.
It's my job. That's what I do. Now that is stuck. Ooh. Oh, there it goes. That too. Bend. There it goes. Okay, it's moving. Oh, this is the one that's bothering you, or are they both bothering you?
Mainly it's my right side.
Let me just test something first.
Okay.
You can relax your arms for a second. Any pain when I do this?
Yep.
Where? Right there?
Right there.
How about here? Does it get worse?
Yep.
And how about this way? I want to let it off on it.
Takes it away.
Takes it away. Okay, so this is called internal rotation here of the hip.
Mm-hmm.
And then when I'm forcing the head of the head of the femur into the hip socket. This is opening it. That's why it doesn't hurt until it gets to the bottom. It could eventually.
Yeah, that's the tight.
At the bottom. On the bottom. Yes.
Yeah, yeah.
Yep. So yeah, you've got definite hip inflammation. Okay, and they haven't taken an MRI of that or anything. So, I mean, you could try to stretch. The thing that I usually tell most of my patients is to just take the hip socket through all of its ranges of motion. But you almost need to separate it. I'm going to do that, but it's not going to. It's only some temporary. You almost need to like
One thing
have a
that,
device and just separate it.
like they were telling me to do is like lean up against the wall and then you do like different stretches.
Look,
Like
the hip
across,
has,
like across your
here's external rotation, right?
leg. I had sugar.
Here's internal would be this way.
Yep.
Okay, you have flexion and extension.
Yep.
So extension would be to take your leg back like this
Yep.
and sit on it. I guess I could show you back here.
Yep.
I'm taking my hip backwards. Okay,
That would probably make. Do you think that would make it feel good?
you need to start doing that.
But if you were just doing that, that looks like it would open my whole hip right up. 'Cause,
Well,
like,
you
it's-
need to do that. Now, partly it's your pelvis and partly it's damage.
Yeah,
So what are we gonna do? I don't know, you're too young for a hip replacement.
I know.
So you have to kind of separate it, get some blood flow into the hip socket. All right, reach overhead and grab the table. Let's do the good leg first. I'm just gonna pull. It shouldn't. There it goes, a little bit. Does that hurt when I do that?
Mm-mm.
Here's the sore leg. It's not going very easily. There it is, a tiny, tiny bit. Okay. Quads.
Because we bought one that's just like a surface massager and it sucks.
This is like $60 or something like that.
No, the $600 massage gun.
You're done.
The Theragun.
It's not the same.
It's just like beating at something. It's not stretching.
Yeah, that's what I feel
Like,
like.
this
I
is
use it on me all the
stretching.
time and I don't really like it.
It just beats you up.
Oh!
Actually works.
You gotta work on it. You gotta work on these.
Okay, you can keep doing it. You're fine.
It shouldn't be that bad. Breathe, breathe. Like my brother said, there should be nothing. But this is why your knee hurts. You understand? It's not your knee. It's your quad. Your doctor wasn't wrong. What he was wrong in was he didn't tell you how to help yourself. This leg shouldn't be as bad. There's just one large cluster right here. That's it.
That hurts.
And then I keep going, yeah. There should be nothing. After this, go watch the video of Dr. Ed working on me. You'll feel better.
Okay.
Just gonna get it. Just gonna
I
get
was about to swat you away.
it. Yeah, no, like.
Just get out.
No, it's alright. I guard myself. Like, people think that I'm like purposefully like jumping the patient. I'm like, no, I'm holding them down
I
so
think
they don't kick me.
I can take more pain on my back.
Yes, the legs are probably one of the most intense regions. But this is coming out. This is coming loose. And I'm not done with the whole leg, but come on up and just see how it feels, your knee. I gotta flip you over, but
Yeah, it does feel a lot better.
you know, it's not gonna feel as tight and entrapped here.
Yeah.
Because
I can even-
all I did was just elongate it.
Yeah. Even like it's still softer on my. I can still feel it there, but it's not.
Yeah, no, it's like a 25% of what it was.
Yeah, it's a lot.
Okay.
It's a lot.
Yeah, you just have to just relax that, okay?
Mhm.
You can take a foam roller and do it to yourself.
Yeah.
And then you don't have to have somebody like me like beating you up. You can do it at your own pace.
Yeah.
The first roll is the worst on the foam roller. The
'Cause
first
you
pass.
feel it?
It was like, oh, I don't think I ever want to do this again. You know, then just keep doing it because it gets better every time. It takes like 10 times before you like work into it the first time. Yeah, okay, you can relax.
Okay.
Yeah, and then down. And then your hands can go here on the pads. There you go. Okay, there it goes. It kept shifting as he moved.
Wow.
Does that hurt? Was that hurt?
That was a little bit.
Right here, right?
Mm-hmm.
Yeah, he's posterior here. Posterior SI. Ooh. Okay. All right, deep breath in. Oh, way out. Okay, good. Deep breath in. And then, see that? Oh, man. Again. That ain't going. Sorry. I come back and I feel this one. Take a deep breath in. They're like going one at a time here. Yeah, this is the one I can't. I mean, it ain't budget. Oh, I'm sorry. It's like wobbling all over. Breathe. Okay, I'm just gonna do the upper back and then I'm gonna switch to the lower back in a second.
Mhm.
Hands on the carpet for me. On the carpet. Yeah, that's it. Okay, breathe. Yeah. Ooh, get some good air, because here we go. I'm going to squeeze it out of you. Out. Let all the air out. Let all of it out. That's it. Again. Breathe. Make it a little easier. That's it. It's coming out. Back to the top again. Staying out here. Breathe. Okay. Whew. Elbow. I'm just gonna be elbow here for a second. Oh my goodness. Whoa, it's like a rock. So arm above your head for me. Yep, just that one. Breathe. Breathe, breathe. Almost done, almost done, almost done. And down, done. You did it, you did it. Back to the other one.
Ooh, I felt that.
Okay, take a break, take a break. That's it. This is the bad one. This is the worst one right here.
Oh.
Yeah, it is. It is. It's the bad one right there. I save it usually for last. See how it's not in here? You're like, I don't know about that. I don't really feel much here. It's all on this side.
Mm-hmm.
And that's very common. I can't blame the rucksack on that. Whatever it's called. What is it called?
Yeah, ruck.
Okay, I can't. Yeah, this is something you've had a while. Oh, there it goes though. There it goes. It's coming down. Yep. There it goes. Whew, just do it. Get it over with.
Exactly.
Get it out of there. There's a lot more range of motion over here. Okay, here we go. Sorry.
You're fine, you're fine.
There you go. Done. Not bad over there. Okay, now I gotta go back and fix this. Breathe. There it goes. Thumbnail opportunity. Okay. I'm gonna bounce all of them.
Okay.
There you go. Ooh. Why? That's different. Why don't you try some Cajun fries?
I love Asian fries.
Diego, the order.
You already ordered.
Oh, we did? Maybe it is. So a quick test to see if I've done anything for your hip, because I'm not sure if I have yet. Does this hurt when I do this?
No. It's a little
No.
tight on my quad.
Quads, that's fine. Any pain?
Mm-mm.
It's a good sign, okay? Let's try the other one. Any pain?
Mm-mm.
Okay. We're doing something. Just releasing that quads is probably half of your problem. It's, it's all related. Trickle down theory. There it goes. Good. Just do the other side. Now, we'll find out. Okay, we're gonna find out whether it's sore or not.
Mm-hmm. Doesn't feel too bad.
Doesn't feel as bad, right? Now, sometimes in the gluteus minimus over here, there's a little cheater spot, okay? It's very common. The muscles all get bound up. So now I want this to move nicely. You're gonna have to check and make sure I'm not showing anything right now, but like I'm trying to get down into that glute. He's got, it's not maybe so much the gluteus, it's the gluteus maximus covers this whole thing, okay? It's the deep intrinsic muscles that I'm worried about. So here's like the piriformis, okay? That's where the sciatic nerve runs through.
And that freaking hurts.
Yeah,
Like
I'm
right
on
there?
it. I'm on it. That's why it hurts. That's your nerve.
That's okay.
You know? Yeah, chiropractors, we know where the muscles are, but what are we concerned about? The nerve.
Mhm.
Okay, so that's the piriformis. That's where your sciatic nerve runs through. Not sciatica. Sciatica is a symptom, okay?
Okay.
The sciatic nerve runs through here. Then just inferior to that, we go one down. Okay, that's the gemellus or gemellus, superior, inferior. Those feel good. You go even further down, obturator, externus, internus. You got them all here. And they connect from the SI joint to the brachial trochanter, the hip right here. So I'm worried about what your hip, right? Why am I worried about this? Because it attaches right here to your hip. Okay.
Yeah, it's where it feels wicked sore right there.
Yeah.
So the best way for hitting this would be for what, doing a foam roller on my side?
Yeah, I'm gonna show. Yeah, you gotta do the foam roller in here. See, I wanna like, maybe I should like drape them. I'm not sure. I wanna kind of like do this or something. People forget about this one. TFL is up here. And you can do. I'm sure your sister would know more technique. You know, they do the figure 8 and all that stuff. I'm like, well, that's a nice start. Nope. You know, you got somebody that's. This is where we usually get me doing these funny poses because my feet are on the wall.
Oh, your feet are on the wall?
Yes.
Ow! That hurts. Ow!
Do it.
Ow!
I know I'm not hurting you.
That is so tight.
Well, see, this is hip surgery. What do you want?
Let's go for it.
Oh, see, feel that one?
Mm.
Ooh, they love to live in there.
I definitely should have drank before this.
No. We need all cylinders firing. There you go. That's it. It's coming out. Okay. Just getting it over with. I'm like, am I going to sit here and play around with this thing for 10 minutes or just do it?
Just do it.
It's done.
You're so mean to me.
I know. You like me later. In about 48 hours. Not right now. Okay. Hey, if it's cleared out, move on.
It does feel a lot better.
Nothing there anymore, okay? Just feel like a back scratch. I don't think you're gonna bruise much. Does it hurt?
Like you gotta.
This isn't bruising. This is just it turning red. He's got like a little one here, but I can't quite pull it through. There's nothing in his low back, not much. I might need a different tool. Bring out the big weapons. You're pretty cleaned out. A little one. Look up and over at the floor. So bring your body up and over. Yeah. Just open up that side for me. It's bright. You've been in a hole like for 30 minutes. No, that's all that's coming out of this rib. Okay, you can go back down again. Does that hurt? Sorry.
No, it's not too
It's a little tender. I'm sorry. just want to make sure I get everything for you. No, nothing. It's proof, guys, that not everybody bruises. They're like, if you take any metal object along with somebody's back, it's gonna bruise. And I'm like, apparently not.
Ours is jade.
Breathe. There it goes. That's it. That's it. Little pockets are releasing. That's it. See, this left shoulder cleared out. Okay. Relax, relax. It's a scraper. It's a scraper. Nothing to be worried about. Yeah, that's that little pocket that just let go right there. I was like, I know. If I release it, more crap will come out. Wait, not supposed to say crap. More metabolic waste will come out. People go, what? What? I think it's just crap. It's just congestion, inflammation. There you go. Yeah, see, look, that side let go easier for whatever reason than your right. That's done. That one's done. Okay, so I'm going to do the pecs because I'm going to stretch you backwards, okay?
Okay.
This is fun. I just grab onto the scapula and like, oh. Well, like right here, can you shoot both of them? Because this is how I get it.
Yeah, maybe.
Like that. Oh. That's how I hold on so he can't, so even if he resists, I've still got somewhere to go. And I just watch for the hands. Don't watch the mouth. Watch the hands. Okay. Am I going to be mean to him and do the subscap?
Yes.
Am I?
There you go for it. She tried to, and I wouldn't let her.
I don't know how I could be any nicer.
It tickles me when my sister does it.
Okay, now I pinch it. Here's the bad one. Okay. Now there's one in the armpit.
That's not yeah.
Right?
Yeah, right there.
Here. Relax the arm though, because you're in control of this basically.
I'm trying to put out
Yep.
my fingers.
No, you weren't too bad. Hey, let go.
Oh, that's not bad.
I think I just did a little too jarringly on you the first go.
Oh, this side's a little better.
Mm-hmm. Hand on your hip for me.
Oh.
I can always go another level. I'm so mean. I know. I'm so mean. Let's do the shoulder.
Okay. Well, how did you hand on the hip some?
Yep. Shoulder back, elbow back and towards mine. I'm sorry.
Oh.
There you go. Relax. I'm gonna go into here again. Trying to be nice, like tread softly. Get it there. All right, hand on your hip.
I feel like she's got it. She's like, no, a little bit more.
I'm so mean. There's always another level. That's the thing. Sit up straight.
Yep. Sorry.
Elbow back.
Yep.
There it goes. That's good.
I moved my hand. Come on, sorry.
What?
I moved my hand. I didn't hold it. Sorry.
No, it moved. It's fine. Look at you. You're much straighter. Does this hurt as much?
No.
Okay.
I got the hot eyes.
Okay, DA, thank you. No, you can leave it over there in the kitchen. Arms, give me your arms. You're gonna look back or stretch your pecs.
I'm gonna look back.
Yep, you haven't seen this one on my channel.
All right.
I debate whether to put these on there.
Do you want me to order something for?
Not right now, Diego. Look up. And we're gonna take you out. That's it. And then in. Back. All right, if you can handle that, you can come on up for me. You should be able to handle the roller. That hand goes there, good. And then your head goes back off the table. There it goes, there's part of it. Let it go, breathe. And other side. Yeah, you're like, there's more? Yeah, there's more. There's always more. You're about to fall off, so I'm holding you. Got it now? Shoulder, give me the shoulder.
Yep.
There you go. That's it, and then head goes off. Yeah. Relax your head though, relax it. Let it go. Yep. Perfect. On your back.
Good.
Back. Bend both of your knees. Yeah, we're gonna do pubic symphysis, okay? There's a joint on the front of the pelvis right here.
Okay.
It's okay.
Okay.
Yep. Not everybody needs it, but you do. You're just gonna press out against my arms
What with my
with your legs.
Oh, my legs. Okay.
Yep. Flex those hips. Push out against my arms. More. I'm strong. You can go ahead. And good.
Oh, that hurt.
And then you're gonna squeeze. Squeeze my hands
Squeeze.
with your knees.
Yep. Squeeze them.
Part of it went, and then it was like done. So come on and sit up and face that way.
Okay.
All right, on your stomach, you can be up on your elbows. I'm just gonna get your hamstrings back here, okay?
Okay.
Because I believe it's over here too. I know, fun. Calves are never fun either, but actually, they don't feel too bad. That's new for me.
They're just pain. I hate my calves.
Oh, I don't really feel much. All right, that's it. We're gonna stretch you out. Yeah, this is what all that work was in preparation for this.
Can I just roll?
No, you're just gonna stay right there.
Just stay right here.
If you can move your arms over your head, that would be better. Yeah.
Let's not get them up.
Okay. How much more do you think you can handle of that? Not much more? You can move it around, but you gotta move it in your thoracic spine, not in your low back. Your low back, you're gonna blow your low back out. Yeah, it's okay. You're all right. You're all right. I promise. I haven't done anything. Now you're gonna roll off. There you go.
This is a nice one.
That's why I have it. There you go. That's what you got to do. Yep. Careful. That last 15 degrees is what I always watch people
Yeah.
trying to get up. Yep.